Okay, all right, so now I am delighted to introduce Megan McDonald. Megan is a professor and the interim head of the School of Biological and Population Health Sciences, and she is a professor in kinesiology, and she is also a co-investigator of the Aspire Center, and she is going to be the facilitator. Megan,
thank you. Thanks, Marie. Thanks, everyone. It's really nice to be here today, and it's great to see such a busy room. A few other just minor housekeeping things. We are recording, so this isn't currently being live streamed, but this will be uploaded on our website so that people can access it later. And this is the mic, so I think you can talk. You don't have to pick it up or touch it. It will pick it up for the purpose of the live stream. And then, do we have the clicker? Oh, it's over here. Okay. Yeah, clicker's over here. So I will take that. But it's also my pleasure to first, before we get started with the brief presentations today, to introduce some of our team members from the Aspire Center. So Aspire Children's Environmental Health Center. And first up, we have our PI, one of our PIs on the project, Molly Kile.
And as the PI, took 3 minutes, so fair warning. But first, I'd like to really welcome everybody to our first Ignite event for Children's Environmental Health. And I really want to thank the people that organized this. So Harvey, Dixie Jackson, Susan Emerson, and Megan McDonald. Thank you so much for doing all the coordinating to make this happen. And then what I intend to do in 3 minutes is just kind of give you an overview of what the Aspire Center is all about. So first of all, I want to disclose that our funding is provided by the National Institutes of Environmental Health Science, and our center will help promote NIEHS's mission of discovering how the environment affects people in order to promote healthier lives, and to conduct and support the very best environmental health science in alignment with real-world public health needs. Our leadership team is interdisciplinary. We have expertise in environmental health, psychology, kinesiology, child development, health promotion, data science, outreach and engagement, and many others. And we all share a commitment to improving the health and well-being of children. So that's the glue that holds us together. So I want to point them out. We've met Megan McDonald, but we have Megan McClelland, who is subbing in for a speaker who couldn't be here. Veronica Irvin is in the back over there. Oh, Veronica Irvin. Allison Myers. Did Nicole make it? Carrie Heistad. Andy Larkin. And then myself. So if you have any questions, please find one of us, and we're happy to explain a little bit more than what 3 minutes fits. So our center is organized into 3 cores. I'm just saying that because you'll hear us kind of slip into that jargon a little bit. Each core supports different projects, and you're going to hear from the development and the translation core next. So who are we? The Aspire Center is one of 6 newly funded collaborative centers in the United States that are developing strategies to translate children's environmental health research findings to relevant stakeholders. This is a new collaboration, newly funded initiative by NIEHS that just started this year. So each center has its own strategy and expertise, and part of what our centers do is connect you to other centers. So I do want to just spend a few minutes explaining what the other centers' expertise are. So for instance, Emory has expertise in science communication and outreaching to urban American women populations. Johns Hopkins focuses strictly on childhood asthma prevention. NYU is focused on system-level interventions that can reduce exposure to chemical hazards like endocrine disruptors. And, oops, blank page got in there. University of Pennsylvania is focused on translating science to clinical information that can address exposures to environmental asthma triggers, lead, air pollution, endocrine disrupting chemicals, focusing on early life. And USC has expertise in policy briefs and is really focused on air pollution produced by the shipment of goods, since LA Port is a massive hub. So if you're interested in connecting to any of those other centers or that expertise, we can help you. And as for our center, the Aspire Center, our primary strategy for promoting children's environmental health is to collaborate with people in our communities that share our vision. So we really want to leverage the unique strengths in Oregon and create partnerships that lead to multi-level interventions. And we want to work with people who are interested in adopting new policies, practices, programming, or are seeking to scale or evaluate evidence-based interventions that are designed to reduce harmful environmental exposures where children live, play, and go to school. We believe in collaboration, and we also believe that we can accomplish more when we work together, share our successes, our hard-earned wisdom, and pull together for the betterment of the next generation. And one of the ways that we're building partnerships is to fund pilot projects. So this is a big function of the centers. So these are open to anyone. It's not just academic researchers. We're looking for anybody who shares our vision that wants to seek to improve children's environmental health. We anticipate being able to fund 4 projects next year. So we have 2 in the development core and 2 in the translation core. A call for applications will be sent on November 3rd. So we all have your contact information. So stay tuned for an email blast. And the deadline for applications will be January 3rd, with awards being made very quickly, with the idea that you'll be able to start off the next year with a New Year's resolution of accelerating children's environmental health research. 3 minutes and change.
Veronica, yeah, you're next.
Good afternoon. My name is Veronica Irvin. I'm faculty in the College of Public Health and Human Sciences and Public Health, Health Promotion, Health Behavior. I'm here to talk today about our translation core. These are the faculty and team members on our core here at OSU. Megan McClelland, who will be presenting in a little bit on behalf of one of our pilot fundees, and she's professor as well as the director at the Hallie Ford Center for Healthy Children, which you're in right now, the building. Dr. Allison Myers, and she is the director of OSU Center for Healthy Innovation. She is also the interim family and community health program leader, and Nicole Bruner, who's our program coordinator. She's not here today. Our core takes what is known in the scientific body of research, what's the evidence, and puts it into the community, or works with policymakers to know about it. It's bi-directional communication. So we have, what our center is working on is doing a scoping review of what is already out there published in the scientific research area or by other programs, but may not be easily accessible by other community partners and policymakers. We are also going to be conducting key stakeholder interviews throughout Oregon to learn about the needs of our community partners and policymakers about what they see as the future and the needs for children's environmental health. We do fund pilot projects that take evidence, scientific-based research, out into the community and out into the policymakers. Today, you're going to hear 2 presentations from our pilots from this year. First, you'll hear what's going on in Ashland, and it'll be presented by Dr. McClelland on behalf of the Ashland team members. And then you'll be hearing from Dr. Emily Little, and she's the executive director of Nurturely, about their Wombs and Wildfire program and what they're taking with the evidence out into the community and working with policymakers as well. So I'll end there. Oh, I have one more slide.
Sorry. Yeah.
And these are our funding that's coming up for this next cycle. We'll again be funding, so our 3 areas for our core is connecting researchers and policymakers, distinguishing best practices for community level change, so what's out already in the scientific area that's going to work best for community members, and translating the research into policy change and action. Again, you'll be hearing from 2 of our pilot projects that were funded this year. We'll be having some new pilots open for, again, 2 pilot projects, each at $40,000 for next year. And again, our window begins in November. The topics this year are our priority areas we're looking at are wildfire smoke and Oregon's Choose Safe Places programming. We are open to other ideas, so if you have other ideas that fit into this idea about connecting community and policymakers with the research, please reach out to us. We are open to other ideas. These are just our 2 priority areas for this cycle. Thank you.
Thank you. And then next up, we have Andy Larkin on behalf of the Development Corps.
All right. This a test. All right. Hi, everyone. I'm Andy Larkin, the guy on the left. Make sure yeah, left. You've already met Megan, and the other professor in our core is Parichehr in the back. He's currently hiding in the back, but definitely go around and talk to him if you get the chance. He's very friendly. All right, so I'm going to, in just 2 minutes, give you a very quick taste of some projects we have going on in the development core. One of the projects we have is looking at social media. Together with a very talented group of undergrads, we're creating deep learning models to extract information from social media about environmental exposures, behaviors of children, social interactions in groups, and health impacts of children. We're analyzing about 1.5 to 2 billion tweets over 10 years. And by analyzing this huge amount of data, we are hoping to identify needs, concerns, and opportunities for outreach, not only in Oregon, but across the entire US. Another project we're working on, again with a very talented undergrad, is data dissemination. We have some very complex data sets that have a lot of information, but oftentimes this information can be very difficult to access unless you have a data science background. So we're creating some interactive website data dashboard tools. And this way, people who don't have a data science background can still analyze this data to gain insights and opportunities for needs. And then finally, as you've heard all of us talk about, Molly and Veronica, the development core also has some awards. We like these awards specifically to catalyze the transition from research to action. The projects that we're looking for are going to have one of the components here is going to be interdisciplinary, or it's going to involve stakeholder partners. It could also use data science to inform children's health research and translation. Or it could be one of our priority topics, such as wildfire or choose safe places. We're going to have $60,000 in awards annually. So this is something to think about not only for this coming year, but in following years as well. And just as Veronica mentioned, the application window for next year is going to open up in November. So we would definitely love to hear from you and see what kind of applications you'd like to turn in, and just definitely talk to us, and we'd love to see what you're coming up with. All right, thank you.
Thanks, Andy. So that was literally, it's 4:15 on the dot, so this group is very efficient. You can see working together. All right, so we're about to get started, and I think just to clarify, this is the Aspire Center Projects and Partnerships, so this is this group. We are gonna hold questions until the end, and for the presenters, after your 2 minutes, the next person will just go. So the order is going to be Paulina to start, Parichehr, followed by Sara/Megan, who's filling in, Emily, and yes, and Dayna. Yes, Allison?
Can we remind folks that the mic is there and not like the other corner?
There's two mics.
There's two microphones. There's one on the front table and there's one behind the podium facing.
Hallelujah.
Yeah. All right. Thank you though for that. So I think, so do we have everyone?
We don't, we're missing somebody.
Yeah, we're missing someone.
Molly's doing it.
Molly's,
Molly's
are you
doing
going for
Dayna.
Dayna?
Okay.
I can do Dayna. I can do multiple people.
Okay, we'll follow up. Dayna's the last one, so we'll follow up on that one closer to that. So 2 minutes, and I'll hand over the clicker. And then Marie, do you want to show us the 30 seconds?
Yes, it's specific. When you're done, you put the clicker right there.
Oh,
Okay,
perfect.
so I can pass it.
Okay.
So this is it.
30 seconds. This is where Marie's sitting.
I've got two of these if I need them.
All right, Paulina, without further ado.
Without further ado,
All right. Thanks.
Yeah. Hi, I am Paulina Kaiser. I'm the Director for Research at Samaritan Health Services. I'm here with my colleague Zoe Herrera. Wave, Zoe. Unfortunately, my kid's over at Kid Spirit, so I'm gonna have to step out at 4:30 for a few minutes. So Zoe's gonna cover for me for just a couple of minutes. Okay, Samaritan is a nonprofit regional healthcare system. So for those of you who may not be aware, we include both health providers. We have 5 hospitals, including 3 critical access hospitals, as well as 80 outpatient clinics, covering kind of every specialty you can think of. We also have an accredited cancer center. Serve about 200 patients per year, covering Lynn, Benton, and Lincoln counties. As well, we have residency and fellowship programs. I believe the total right now is 108, I heard this morning. We also include a health insurer, Samaritan Health Plans. The largest line of business for Samaritan Health Plans is Intercommunity Health Network Coordinated Care Organization. I never say that fully out loud. IHN CCO. So this is the CCO that administers Medicaid, again, for Lynn, Benton, and Lincoln counties. I think that's over 80,000 people now are IHN members. So that's who we are in terms of research opportunities. Resources, we do have some staff in research, primarily me and Zoe, and we have a biostatistician who works as well. And we also have a clinical research team that largely supports the kind of pharmaceutical sponsored projects and clinical trials that Samaritan participates in. We also have lots of data, guys, lots of data. So we have an electronic medical record system, EPIC, and then again with IHN CCO, so that's all of the Medicaid claims for our region. Got lots of kind of energy and enthusiasm to throw at research. Particularly residents and fellows are actually required to do scholarly activity projects. And so that's maybe required energy, but it's still energy. And finally, we also have clinical services, and we can partner on projects to provide physical exams, lab analysis, pharmacy needs, that sort of thing.
Okay.
Oh, thank you. Specific.
This has been out a while.
Oh no, I'm sorry. Okay, yeah, we can do stuff with kids too.
Hello everyone, my name is Parichehr Salimifard. I'm a new faculty assistant professor at the School of Civil and Construction Engineering here at OSU. So just a brief introduction about my background, because it's odd that I end up in public health and environmental health area of research with engineering background. I did my undergrad in mechanical engineering and then architecture engineering with mechanical engineering focus in my master and PhD. And then I did my postdoc at Harvard School of Public Health, and I'm happy to be here with you all. So this is an umbrella, kind of a schematic of various areas of research that I focus on in my lab, but it all is under the umbrella of sustainable, healthy, and resilient buildings. We think buildings are important. Built environment is important for not only the energy aspect, which was my initial kind of draw into buildings from that energy and mechanical engineering background. We know that buildings have the largest share of energy footprint, and therefore why we have also a large climate impact and damage footprint from buildings. And then as a result, we're here all very familiar with the environmental health aspects and consequences of energy footprint from buildings. But that's not all. This is all from just atmospheric and outdoor exposure. We know that indoor environmental exposure is also very significant for our health. Some of the examples that are very front and center of our mind, especially in this area, is wildfire, which we all care about, and also COVID that kind of shut down the whole economy for the whole US and also the world. The reason for that was we have not been using and leveraging the latest state-of-the-art HVAC and mechanical ventilation technologies that exist. We have not used that in our buildings. The part that I'm really excited about today to be here with you all has been thanks to this center to have sponsored an area of research that I'm excited to start, is to be able to use and leverage aerosol science and dynamics, as well as the latest HVAC control systems to have buildings that are resilient and healthy, not only from indoor sources such as COVID and next round of virus and pandemics that we may experience, but also for outdoor sources such as wildfires. So with that, I will conclude that.
Thank you.
Yeah, do you want a clicker?
Oh, sure. Yes. Hi. So I should just start talking, right?
Yes, you should.
My name's Megan McClelland. I'm the director of the Hallie Ford Center here, and I'm the deputy director, I think is the title of the Aspire Center. But I'm really pretending to be Sarah Jones, and she is representing the city of Ashland, and one of the pilot projects that we have awarded as part of the Translation Corps. And I'll just put up this lovely thing. What we're really excited about is Smokewise Ashland is a local collaborative working group down in Ashland that is dedicated to protecting public health, creating community resiliency, and in the face of this increasing wildfire smoke that they are experiencing all over Oregon, but especially in Southern Oregon. And this overwhelming need to reduce, whoa, this just is going on its own. I don't know what to do. But anyway, so as part of their pilot project, Smokewise Ashland is what they're doing is they're trying to answer some questions about air quality monitoring in early learning settings in schools. So the questions that they're going to be answering are things like, what policies should schools adopt to keep children safe from particle pollution? Are the education facilities built for more wildfire smoke? This is getting at some of the air quality monitoring that they're going to be doing. What size of air purifier is needed to clean a classroom? And then they're also looking into barriers that exist to working with organizations in order for them to better adopt these smoke policies. Yes, I'm 30 seconds. And then also answering questions about, like, we are getting lots of questions around when is it safe to train outside? When is it safe to go outside for recess? And so they're also going to be looking at it. We're really excited to be partnering with them, and we think they're doing really fantastic work down in Southern Oregon. Okay, I'm done.
Great.
No, Emily's right.
Emily.
Oh, sorry.
Oops. Hi everyone, thank you so much to the Aspire Center for their partnership and support. I'm really excited to be here today. My name is Emily Little and I am a perinatal health researcher and the executive director of Nurturely. My personal research background merges perspectives from psychology, anthropology, and public health to examine cultural models of infant care as well as pregnancy and postpartum health behaviors. This led to the founding of Nurturely, which is a community-based nonprofit organization that aims to bridge academic research with community-based wisdom and lived experience to really tackle the root causes of inequities in pregnancy, postpartum, and infant health. We create equity-focused trainings for healthcare professionals, community members, bridging all of these different perspectives. And specifically with the Aspire Center, we are really excited to announce the Wombs and Wildfires project. This is examining the really urgent problem we have in Oregon of wildfire smoke exposure during pregnancy, which we know from epidemiological data is extremely harmful to pregnant people and their developing infants. And so our goal with this project is to amplify and center community-based wisdom and lived experience alongside the epidemiological data that we have to really invite in policymakers, community leaders, people with power, elected officials to really create change and co-create a set of communications toolkits, policy recommendations, and other actionable items for change in terms of protecting pregnant people and specifically pregnant people from communities of color. So I invite everyone in this room. We'd love to hear from you if you have research on wildfire smoke or pregnancy or anything related. We'd love to hear about you and highlight your work through these ongoing series of work groups. We also are continuing to conduct interviews of people who have experienced either firsthand or secondhand the harms of wildfire smoke in pregnancy, and just invite everyone to prioritize pregnancy and postpartum when we're thinking about children's environmental health. Thank you so much.
One of the things about an Ignite session is keeps you to time. So I am going to be presenting on behalf of Dayna Swanson, who couldn't make it here as well today. She's one of our pilot project awardees from last year, and she's really about protecting early learners from harmful chemicals. So she's an early childhood educator that's up in Bend and helps to run two healthcare centers up there. So her pilot project is selecting future facility sites in alignment with the Oregon Health Authority's Choose Safe Place program. So this is one of those multi-level interventions. The CDC kind of came up with this program. States have adopted it. The Oregon's Choose Safe Place is a statewide initiative designed to help child care centers make their properties safe for kids by protecting them from potentially harmful chemicals. So this is one of the lessons that's been hard learned because some early childhood learning centers have been placed in areas and in buildings that had hazardous chemicals, such as old armories that were polluted with lead, or next to hazardous waste sites. And there is a new child care center that is being built for the Little Beavs, which is part of Cascade Campus's childhood programs. And one of the potential sites there is locating next to a landfill. So there's a lot of questions in the community about, is this the right place to be putting this building? What can be done to mitigate these potential exposures? And this is the right time and the right place to be having these conversations because we're in the planning stages. The other thing that she's going to be doing is, this is another kind of multi-level intervention where there's a program that's called Eco-Healthy Child Care Facilities. And this is a program that helps early childhood learning centers use an evidence-based checklist to try to make their child care centers more environmentally friendly with less environmental chemical exposure primarily that we know are harmful to children's health. So it's kind of a 12-point checklist, and we're trying to adopt some of these programs here in Oregon and build this as an opportunity for early childhood centers to protect children's environmental health while they're also really helping to raise the next generation of the next generation. And I'm out of time.
All right, thank you to all of our presenters. So we have a little less than 10 minutes for questions. Are there any burning questions from the audience members or from the presenters themselves to other presenters?
So we can consider.
Sorry.
It's 4:30 pickup.
I'm happy to kind of get us started. Zoe, actually, you're going to be the first one. Sorry. So when, with the residents and fellows, have they ever linked up with some of the work that they do and with the data that you have with OSU faculty that you know of?
So I just started in July. So
Okay.
Since I've started, that hasn't happened. But that being said, like, they're very interested in like coming up with ideas, or if someone like approached us with an idea, we could help like set you up with a resident, find someone who's interested in that field, and then you could still have like residents help you with your project.
Great. Yeah, thank you very much.
I could comment on that. As a faculty member, I've worked with Samaritan, and they have on EPIC data projects, and so working with some of their fellows and some of their medical students on projects. So it's been a great way to do that. And also a way to, Samaritan has also connected us with some of their patients to do in-depth interviews. So a lot of interaction both ways with Samaritan.
Thank you. Any questions? Perry.
Sure. This question's for Emily. I was wondering, I love your idea of connecting the lived experience with like epidemiological data. How do you think you're going to go about doing that? I'll give you a couple more minutes.
Yeah, so really our goal is to just create really interdisciplinary, intersectional learning and conversation spaces. So it just starts by breaking down those silos. You typically, in my experience in academia, was that academics are talking to fellow academics at conferences with specific jargon, and people in the community are having community-based conversations that look very, very different. And so our goal is to bridge those two with community-based spaces, whether virtual or in person, make them as inclusive as possible for both sides of that spectrum, and really just start by having a conversation where we are simultaneously highlighting, for example, the work of Rebecca Schmidt at UC Davis, who's studying wildfire exposure and pregnancy, and work with researchers to make sure it's inclusive and accessible presentation, and then also highlighting and amplifying lived experience as just as important as those data through our series of workshops, and then coming together to actually collaborate on next steps in terms of things that we want to create together. So far, it's really been the basis and the foundation of all of Nurturely's work, and I think we've done an okay job at it so far.
That's great. I think that's like for here, I think that's really important. As someone who does environmental epidemiology, we always get local communities saying they want like data for their community and they want evidence for their community. But there's a lot of limitations of sort of doing local epidemiology in terms of just uncertainty and size of number of people you need in these studies. And so I think that approach is actually probably the first step to answering a lot of those local questions. So I think, I think that's an excellent approach. That's great.
Thank you, and I would love to chat more and see how we can bring in different types of.
Thank you. Other questions? Parichehr, I was curious when we talk about buildings and like how So I work in a really old building, so I open the window a lot for various reasons. But what's the goal? Climate controlled, in a snapshot. What's the goal with some of these buildings that they're following policy?
Are you asking specifically for this project or in general?
In general, where are you going with some of your work?
Okay, so in general, I think one of the divides that we've had in at least since I started when my grad school has been between energy efficiency conversation and research and healthy buildings. There usually has been this kind of conflict where energy efficiency has been pursued with the sacrifice of healthy indoor environment and reducing ventilation maybe, or maybe we are doing weatherization but we don't have enough ventilation that is making up for the reduced infiltration, for example. And that resulted in adverse health outcomes. On the other hand, in much of the healthy building conversation that I have had experience in the past, and hopefully that is changing now, there was a lot of focus on what are the measures, but not how can we balance both so that we have, because at the end of the day, if we are increasing the ventilation to the max and it's not optimized for sustainability as well, that energy should come from somewhere, and we are putting emissions somewhere down the road that it's gonna again come back and bite us. So I think the overarching goal, as I see it, is having a balance with buildings that are sustainable, meaning energy efficient and high performing, and also healthy, and therefore as a result are resilient.
Yeah. Thank you. Thank you. All right, well, I think we're actually right at time. So thank you to our first group of presenters. And you're welcome to go back to your regular seats if they still exist. And next up, we actually have two distinct groups. So in the next group of presentations, so we have a group that in the healthy development and safe school environments, and then we also have a group in the environmental toxicology and climate change impact on children's health. So I am going to ask all 6 presenters to come up, and we'll save questions until the end of all 6. So we have Sharon Shen, Davis Harte, Meredith Cox, Alyssa Shiel, Matt Bozigar, and Erica Fleischman. Thank you. All right, and now you all got to see it once already. Okay. Now we've got it down. We've got it down to a science. So first up, we are going to have Sharon Shen. Oops, here we go. These are the 2 distinct groups. Here you go, Sharon. Thanks.
All right. Hi, everyone. So my name is Sharon Shen. I'm an assistant professor in play and playfulness across lifespan. I realize I'm odd ball here. I'm going for it. So our Hill lab is housed in College of Forestry, and in Hill we do research on the assessment and activation of play and playfulness in both children and adults. And today I'm here to share 2 research ideas that support children's environmental health by focusing on the human dimensions of the child play environment and an innovative play material that engage children in active play in outdoor environment. So the first one, play for parent, our motivation. Today's children are at increasing risk for play deprivation due to the overemphasis on structured activities, decline of play in school, and increasing trend to turn childhood into a time for resume building. Myself is guilty as charged. And the parents play a really crucial role in supporting children's play. And I don't need to emphasize more. We have lots of parents in this room. So the problem is most existing play intervention including parents as co-implementers. They focusing on teaching play skills to children, and very few have explored ways to help parents to become more playful facilitators and playmates. So through Playful Parents, we are hoping to increase parental playfulness as the most key human factor in children's play. And I want to jump to the next idea, which is a probe. It stands for Playful Robot, Outdoor Body and Explorer. We are collaborating with the Share Lab. And the real motivation behind it is today's children spend lots of time in built environment. They spend time outdoors like much less than the previous generation, which coincided with the increasing trend of childhood obesity. So through probe,
One more statement, you're on.
yeah, through probe, we are developing a wearable and a portable socially assisted robot that will draw children out of into the nature, into the outdoor environment to engage them in active play and exploration.
Thank you, Sharon. Should just did it work? Pressing the left side of it. Other way, so that one. Yeah,
That's great.
there you go.
Excellent. Thank you, everybody. I'm Davis Harte, and I'm here to speak about the work I do to investigate the intersection between the physical environment and children and community health. When I speak of environment, I mean built, spatial, architectural, designed environments. I was an early childhood educator for nearly 10 years before becoming now a graduate degree holder of Oregon State University's Design Master's Program, and I am a courtesy faculty member in environmental sciences here at OSU. I do work full-time as a director of the Design for Human Health program, where I'm also a faculty member. I teach a Play and Health for Design course, elective at the Boston Architectural College, which is a first of its kind online asynchronous program, after applying to OSU many times. My team and I from the Trauma-Informed Design Society have developed a new evaluation tool, which I am here today to introduce you to. Tool, this is the audience. Audience, this is the Trauma-Informed Design Evaluation Tool. It is worked by over 100 people, designers and educators across the country. And within the space of mere 8 months, it was like an Ignite session. We were able to develop this tool that schools have been responding to wildly the last 2 weeks since it's been launched. So you're on the cutting edge. Please scan the QR code in the middle to visit our website and access the tool. And in my spare time, I co-founded the Global Birth Environment Design Network. So we have other things to talk about there, which is interesting to create a knowledge repository. Both are translational projects. We're very excited to bring evidence, academic work to real people in the real troubled times that we're in now. So I'm really appreciative to have had the time to meet with you all for a few minutes. I will be here for a little bit after receptions until I run to the theater to do community health in action with my own child. So thank you, and I'm pretty sure I'm under 2 minutes because I haven't seen the sign.
Thank you. All right. Next up. Okay. Here we go. All right. I'm Meredith Cox, and I'm the project coordinator with the National Pesticide Information Center. NPIC is an information resource about pesticide, health and environment, and safety information. It's actually been at OSU for the past 25 years. If any of you have ever heard of it, probably a lot of you have not. But we operate a national hotline and a very extensive website of information. We're funded by the EPA. And I'm going to talk about disinfectants, because who here knew disinfectants are actually pesticides? They are, in fact. And as you might imagine, over the course of the pandemic, we had a lot of calls about pesticides or disinfectants to our hotline. And some of the more concerning ones were regarding the overuse and misuse of disinfectants in schools. So, one of the main concerns of pesticide or disinfectant chemical exposure would be things like breathing risks, asthma. And so some things we heard from folks were people, including children, using disinfectant chemicals on their body as if they were hand sanitizer. And we know that disinfectants are not for bodies, they're for surfaces only. We've heard about teachers telling children, handing out disinfectant wipes and telling children to wipe down their tables every day and their own desks. We know children should never be handling pesticides. Hearing about teachers and custodial staff going in and spraying the air and spraying all surfaces with disinfectant chemicals while children are out playing and working. We know that shouldn't be happening. The children should not be in the classroom, and they should not be ideally in the space until it's been ventilated and all of the treated areas have dried.
but we're hearing a lot of these horror stories from parents and teachers. And obviously there's some concerns about increased disinfectant exposure in the name of public health. And so what we mostly do is we're an information service. We try to steer people in the right direction when they call our hotline. And if you're interested in learning more about the different informational materials and collaborations we have done throughout the pandemic, look us up. That's the very long URL that is the archive for all of our COVID-related materials at NPIC. But if you just look up National Pesticide Information Center and disinfectants, you can learn more, including we did a paid, online paid ad promotion campaign as well that targeted people across the country with these sort of disinfectant safety ads. So, there we go.
Hello, I'm Alyssa Xiangyou. Let's see, there we are. I'm a faculty member in the College of Earth, Ocean, and Atmospheric Sciences. So I'm just next door, but I don't know most of you. My background is in geochemistry. I have expertise in mostly heavy metals, heavy elements, and looking at their distributions and tracing their sources, primarily using isotopes. My tool of choice is usually a mass spectrometer of some type. The one pictured there is for looking at isotopes of heavy metals. In urban studies, I'm often looking at soils or moss or even honey, and trying to get a picture of the distributions there and looking at different sources. A few years ago, I think 2016, 2017, several of you may remember these reports coming out of Portland about the high cadmium in different places, including in neighborhoods and near like a daycare center. And it wasn't being regulated, and it was associated, it looked like, with these glass manufacturers, right, these art glass manufacturers. And that was captured by work done by the Forest Service looking at moss, and it's much higher density sampling than you can do with air monitors. You know, you have one air monitor for Portland, well. And so that missed it, but this moss study found those high areas of cadmium. And similarly, they found that same study identified these really high areas of lead. And we're going back now and trying to see where that lead is coming from and why it is where it is, because it's a little high everywhere, guys, but it's very high in some places, including some neighborhoods, and you go there and you really just don't see anything going on that could be responsible for these. And I mean, normal distribution or levels in the city are like 1-2 ppm, and then we have these neighborhoods that have like 20-30 ppm. That's really surprising. So we think a lot of this has to do with legacy leaded gasoline and lead paint use. And we're trying to understand those distributions and what they're like in the city. And hopefully that information can be translated to the public, translated to people so that they can avoid exposures. Okay, so anyways, I'm looking to work with people on that.
Okay, great. Hi everyone, my name is Matt Bozigar. I'm a new assistant professor and I'm in epidemiology. So I was trained as a spatial epidemiologist. I'm going to try to make this quick so I can get to the main event. I have some research teams listed there, but really what I do is focus on how place affects your health. So that manifests in a variety of ways. I've looked at a few different outcomes, several different exposures, and my most recent kind of interest is on radon. So radon, we've known about radon for a long time, but I think we don't know a lot about the health effects of radon as it's kind of been reintroduced to our psyche again, as it's become more important, as we found. It is the main risk factor for lung cancer after smoking. So you take out smoking and you're talking about radon causing lung cancer. That's been established. What's underappreciated, I think, is that the radon and its progeny, its radioactive progeny, attach very rapidly to ultrafine particulates in the air, which can easily go into the body and translocate. And as we've learned more from the air pollution literature about the translocation of ultrafine particulates throughout the body, finding, for example, heavy metals in the small particles of heavy metals in the brain. We have kind of started to appreciate this more, and the olfactory pathway may in fact be a route into the brain, for example. We don't know much about early life exposures, and there's been several studies that have been funded by the NIH very recently on many different outcomes kind of across different bodily systems. My question, I guess, is could radon be a contributing factor or cause of early and later life non-lung cancer, so cancers of different types, in addition to many other diseases? I have lots of needs, and this is a growing area of interest, and if anyone would like to talk to me about it more, I would be super grateful. So, thank you.
Thank you. Thanks so much. And Erica, your final presenter.
CEOs is your bridge to refreshments. Please remember that when you think about your colleagues. All right. So climate science is, we make a lot of projections in climate science. 3 areas that are of great relevance to human health and are not well understood in terms of children's health. They occur independently and they're a problem. They're also coinciding and they're a problem. So extreme heat, ozone levels are more often, even if you hold ambient ozone constant, it's more increasingly co-occurring with high levels of fine particulate matter, and then smoke. So smoke and all of the toxicants that come along with that, not only fine particulate matter. Obviously, epidemiology and human health also are predictive or making projections. These things are not often brought together, and that's what a team of us are trying to do. So we have a team of 9 people that are working together now. We are hoping that that team is going to expand in the near future. So me, Marie, Megan, Molly, Perry, Diana Rollman, Vivek Shandis at PSU, Ellen Peters at University of Oregon, and Deepti Singh at Washington State University. We are working together to do 3 things, and we're just starting out. One is we want to look at future risks to children's health by bringing together these 2 predictive sciences that often have not collaborated. We want to look at what it would mean to do this big, and that means that hopefully a lot more people at multiple universities and in multiple disciplines will get involved. And we also are working with communications researchers and experts to say, what would a communication strategy look like around that? And can we bring in community health entities? Can we bring in educators to help us say, who are the people that need this information the most? How can they inform what we're doing? How can we all work together? That's it.
All right, thank you so much to all of our presenters. So we are ready for our Q&A. Does anyone want to get us started?
Okay, I'll start. I have one for Dr. Harte. Could you explain what trauma-informed design is? I'm sorry I missed that.
Yes, it's a newly evolved concept that is understanding how the built space affects mental health and well-being, looking at what we understand about how the nervous system regulates, and creating a folded-in framework of understanding stress regulation in interior spaces and exterior. It's any space will do.
Great, thank you.
There's drama everywhere.
Meredith, with what you were presenting, and I believe some of our current pilot projects, there just seems like there's such a natural collaboration with information and getting it out. I know that one of the stories that we've heard is that early learning staff are up to date on what the protocols are, but not necessarily the janitorial staff. And so there's this disconnect.
We have a lot of materials, infographics specifically designed for child care centers and using bleach or using just disinfectants in general. And they're all like free and available on our website to download, print, hang up on your child care center wall.
Yeah. Great resource. Thank you. Other questions? Yes.
For Sharon and the Playful robot. Because earlier I was talking and thinking about, we're concerned about young people just being, this is their world. And so have you had now experience with the robot enticing children out into the outside?
Appreciate the question. So that's actually part of our motivation because the kids spend so much time on screen and the pandemic's not helping. Yeah, so the Playful robot is, the idea is actually use the technology as a solution away from screens. So there's no screen involved in that robot, but it's still developing. So we will find out once we have a prototype. Yeah, right now we are working with Kaplan Foundation to try to develop a prototype. So we'll find out if robot is more effective drawing the kids out. Yeah.
Thank you. Any other questions? Sharon, what is getting kids outside right now based on the work that you know?
Well, the kids are really not spending much time outside. So we actually collect the data during the pandemic. The general trend is not just kids, but adults too. You know, it has been a lot more sedentary and spending lots of time in front of screens and inside of the house. So,
thank you.
Yeah.
Any final questions for the group? Marie.
Well, I always like to say, since we have a little time, is there something that you wanted to say and I thought you
Oh, Marie. That was so sweet. Oh, yeah, go ahead.
I didn't get caught off of time, but I forgot to mention the funders for both of my different projects. So that is not okay. American Society of Interior Design Foundation funded the Trauma-Informed Design Framework, and SHRC in Canada, which stands for Social Sciences Humanities Research Council, is funding our second cycle of grant funding for the Global Birth Environment Design Network work that we're doing. So here we go. To box.
Well, I anticipate some very good collaborations that are about to happen, and I did want to share my own story from the original Ignite session, which was, do you remember when that was?
I don't know, but it's a great story.
Early, yeah, the very first one that was here, and I met a collaborator at that. We had never met before, and we are still working together and have received more than $2.5 million in NIH funding since that. So I'm very hopeful that that's the beginning of maybe some conversations that we can have over hors d'oeuvres or wine. And thank you to everyone that was here today and participating. And please, there are a number of us, maybe everyone can raise their hand from the center. We can help connect with people, chat more, and keep those pilot projects in mind too as you're thinking about what's next and thinking about some of those collaborations. So is catering here? All right, we are ready to move on to the Friday evening portion and to have some conversations. So thank you all. Let's give everyone one final round.